Hello, I'm Dr. Dennis McKenna. I'm joined today by Mary Alice Cullen.
Hi.
Great to have you here again.
Thank you.
Everybody knows Mary Alice, of course. And today is March 2nd, 2023, giving you the update from Albany Med. So, Mac, we were talking before the camera came on. If they only knew the conversation we had, right? Talking favorite movies.
Yep.
Right? We went through our whole list there. It was actually lots of fun. Okay, let's put up in the first graph here. Back in the day, when we did these every day, Fred and I would often begin with a video that showed the status of COVID, how many cases were in the hospital, all the different trends. We fortunately haven't really had a need to show them as frequently with the recent videos, but we're going to put it up here today because this is a graph. I think we've shown this once before. This shows 3 different seasonal viruses at the same time. And it also shows the cumulative effect of all 3. And what you can see really very easily there is that COVID, influenza, and RSV are all going down. In fact, the second and the third ones there, influenza and RSV, for all intents and purposes, are not even happening in the hospital anymore. There may be a case, 1 or 2 there, and COVID is still trending down nicely. If you look at the number of people in the hospital with COVID who are still symptomatic or potentially infectious, that number's around 30. People will probably remember the days where we had as many as 180. Now, obviously, an area that you know a lot about had a lot of issues and challenges with RSV last November and December, a very difficult year. A lot of children needing our services here. But again, the good news there on that graph is you can see those numbers are basically 0. You want to spend a moment or two talking about RSV this year and how the Children's Hospital stepped up to deal with that?
Yeah, it was interesting. So we had a very early respiratory season, and we were under siege basically in the Children's Hospital between the pediatric emergency department and the floors and our peds ICU. So we were having a lot of challenges with capacity and being able to take all of the kids that we needed to take. And so what we were trying to do was also help our region. You know, we have a big responsibility to our region. And some of our affiliates, not just in our system, but other hospitals were reaching out to us for help. So what we did was we pulled a team together, Dr. Danziger from the ED, Dr. Ostrov, our chair, Dr. Trish Hopkins, our hospitalist, our nursing leadership from all areas, and we worked with the other hospitals to share our protocols and also offer some education too. So we've been doing a lot of outreach from pediatrics.
You know, events like that, you know, remind us that we have the only children's hospital in the area. We have the only pediatric ICU in the area. We have the only level 4, highest level neonatal intensive care unit. Obviously, we have the only pediatric emergency center. So, you know, those patients are going to come to us. You know, we were talking about movies. I think about that scene in Apollo 13 where they emptied the box and they said, we have got to figure it out using these things. That's sort of what the team does.
That's right.
And, you know, it's a good opportunity to remind ourselves. We may have mentioned this on a video before. If we have, it's worth mentioning again. We also recently were surveyed by the American College of Surgery for our pediatric level 1 certification. In this case, level 1 is the highest. And obviously, I'll let you talk about the results, but one of the things they talked about was how impressed they were that everyone they spoke to said, as a matter of mission, wherever the children are, they want them to be able to come here.
Right.
So how did that survey go?
So the survey was great. So prior to the survey, 2019, we were accredited as a level 2 pediatric trauma center. Adults, we've been a level 1 for a long time. And so we were going for level 1 designation. So the team, led by Colleen Savage, who's the nurse manager, and Dr. Mary Edwards, her physician partner, in this, along with many people, prepped. It involves a lot of education, a lot of data, a lot of case review. The surveyors came in glowing. They loved our program. They loved our people. They loved our passion for the community and our mission, how connected we are. And basically no findings at all.
It's incredible.
It really was.
Yeah, and it validates what we already knew, which is that it's a remarkable program. But congratulations to everybody, and I do mean everybody involved in making that happen. So wonderful. Mary Alice, another thing that I know that you're very passionate about because you've participated in the past as a panelist are Schwartz rounds. Again, this is a reminder, we have one coming up on March 8th. This topic is cultural humility. And again, I'll tee it up. I mean, we take patients in here from not only the immediate capital region, but beyond. When you walk around here, you quickly appreciate the fact that there are people from many different areas, many different cultural backgrounds, many different nationalities that we care for here. Working in the emergency department, it's not unusual to have to use a translator phone because the person we're caring for may not be able to communicate in English with us. That's an interesting topic, and obviously that's a topic that the Schwartz rounds will dive into. You want to offer any commentary on that?
Well, on Schwartz rounds or the topic, but I think to your point, I know that teams work every day to meet those individualized needs of patients, and a lot of that has to do with cultural background, and it's very important. It's
an important topic, and Schwartz rounds you can attend in person. You can certainly remote in from a link that's available on the internet, and they're very well received. So look for that. Okay.
And it's a great time of reflection for staff that attend. It's private, and it's a great avenue for all of our caregivers here in the organization.
And what happens in that room stays in that room.
Exactly.
Very much so. All right, you know what I love, Mac?
What?
I love a good run. I love a good run. So we have one
that about you.
We have one coming up, the Workforce Challenge. So the sign up is available now, and the actual run itself is going to be on May 18th. Now, a couple of things here. For the first time, I believe, we're going to actually have a system team. This is very exciting. I used to run with the emergency department. We had a team. And then ultimately, we joined forces and we put together an Albany Medical Center team. Now we're going to have an Albany Med Health System team. And historically, we have the biggest team there. I'm certain now we'll still have the biggest team. And it's lots of fun. And it was normally downtown, and then it moved out to the Altamont Fairgrounds. It's back downtown again. It's a great night. And we're encouraging everybody to walk or run or jog or somewhere in between. But get out. We'll get you the T-shirt, sign up. It'll be lots of fun.
Yeah.
Can we count on you? You think you'll run?
Can I walk?
You can walk. You can walk. You can walk. No, and we have folks who do that. No, it'll be great. We'd love to have you do that. One of the things we talk about, Mary Alice, is that we're an academic medical center. We take that opportunity often to remind ourselves we do clinical care, we do education, we do research. Recently, there was a press release that I think is very noteworthy on research done in our Department of Urology, done specifically by Dr. Badr Mian, and of course, he had help of other researchers in his department. And this was looking at the use of opioids caring for patients after having major urologic surgery. So why is this important? Well, we hear a lot in the news. We read a lot about the problems of the opioid epidemic, and we hear about people who are taking and can't get off of painkillers. And often in the past, we know this, some of those addictions start with the prescription of opioids after major surgery. And there's been a major shift in the thinking in medicine over the last many years to try to reduce the use of opioids. And we have programs here on this campus, including one called ERAS, right, which is enhanced recovery after surgery, or expected recovery after surgery. And that's a program which is specifically targeted working with anesthesiologists, nurses, others, to try to care for the patient in the preoperative, operative, and postoperative state with a reduction or actual elimination of opioids. So not using morphine, not using Dilaudid, not using codeine. And the patients have, interestingly, better outcomes, quicker recovery, better experience, and they leave the hospital and they're not taking these medications. And what this study did in urology is it showed in what we call a double-blind study, where the individuals don't know necessarily what they're getting, that their outcomes for 98% of the patients who didn't have any opioids could come out of the hospital safely. It's a remarkable study. It was published in the Journal of American Medical Association Surgery, and it's a landmark study. And I think it's going to change really the landscape of how care is delivered, not only in urology, but other surgeries.
Well, it's a great program.
Yeah, and I know the nurses are involved in that program, and they're very active following up with the patients and helping them.
Yes, yep.
It starts really with a conversation with the patient even before surgery.
Right.
To set the expectations that we're going to change the way we would give medications during surgery, and you won't have to go home, which I think patients like the fact that they don't have to go home on narcotics.
Yeah, the nurses do a lot of work evaluating patients for appropriateness for that, and a lot of navigating with the patient, which is great.
Well, so great study. I certainly commend the Department of Urology and Dr. Meehan for that. All right, Mac, the Pillars of Nursing is an annual event here.
Yes.
It's a wonderful event where we recognize the best of the nurses here on the campus. There's usually 5 or 6. And I believe you're opening up nominations. Is that correct?
That's correct.
So March 3rd to March 20th?
Is when the nomination will be open, so it will be posted on the intranet tomorrow. There'll be a link. So go in and nominate who you think are the best nurses here at Albany Med. And during Nurses Week, that's when we announce the winners.
Nurses Week normally coincides with the birthday of?
Florence Nightingale.
I was about to say Florence Henderson. That was Brady Bunch. No, I knew it was Florence Nightingale. But I remember learning that was absolutely like nursing is so closely tied to Florence Nightingale that her birthday kicks off Nursing Week, which is really very wonderful.
Our first theorist in nursing. Yes.
It's available not just to nurses, but is it also available to PCAs, or is it just for nurses?
Just nurses.
Just nurses, okay. RNs and LPNs?
And APRNs.
And APRNs, okay. That's the part that I wanted to make sure we called out.
Yes.
Okay, very good. Success stories in the past, well, we've had those.
Yes.
That is for both nurses as well as for PCAs.
Yes.
All right, well, we have a lot of wonderful nurses here, and we certainly encourage you to nominate them. Yeah. Speaking of nominations, the Times Union Best of poll. We go on the intranet and you can vote. And there's 2 categories that we know that people would be interested in: best hospital and the best urgent cares. So and if you voted legally, you can vote again. So we encourage you to do that as well. So please do that, and obviously we look forward to those results when those come out. Yeah. All right, very good. What else? Anything else going on? No? No? A lot, right?
A lot's going on.
I do know our facilities team this week was very busy, and we thank them for helping us get cleaned up after the last snowstorm. And there's another one expected Friday night. We know our workforce still shows up here, even when it snows, 24/7, caring for the patients that are already here, caring for the patients that will be showing up. So thank you for the assist earlier in the week, but also thank you in advance of what's going to happen probably in the next 36 hours or so.
But spring's coming.
But spring is coming. Very good. All right. Well, we appreciate you being here very much.
Thank you.
All right. To everyone who's still here on the weekend, we appreciate you now more than ever. And we'll look forward to seeing you again in about 2 weeks. Take care of yourself, take care of each other, and we'll see you in 2 weeks.